Hi, everyone. I'm Ajay Gopal. I'm CEO and co-founder of RX Studio. I lost two loved ones, my grandmother and a friend's wife, to the right medication, but prescribed at the wrong dose. So our company is on a mission not to let that happen again. 41%, which is over 200 million prescriptions this year, will be ineffective. They'll cause over 250,000 deaths. And the core reason is because most of us will respond slightly differently to the same treatment. And making up for that variance leads to a lot of trial and error on the care provision system, from clinics to prescribers to patients. And on a net basis, we end up wasting over 12% of everything we spend on healthcare. The worst part is what the patient feels, which is, a 40% chance of failure, which is almost a coin toss, and there's a loss of trust in the medication process itself. So if we want every patient to have the maximum possible chance at a good outcome, we have almost no option other than personalizing that care. That means making sure that the initial prescription is sensitized to the constitution of the patient, making sure they have proper monitoring schedules, and we're in fact adjusting prescriptions based on how the patient is responding. If we do this, it promises to cut costs and risks across the board for everyone who's involved in that value chain. That's where we come in. RX Studio has brought the power of population models into this decisioning system, where we recommend close to the optimal prescription. Think about dose, frequency, formulation if it's oral, or infusion times if it's IV. We prescribe that. We suggest optimal monitoring schedules, and we also have algorithms built that adjust dosing based on monitoring feedback, like lab data and so on. We've also integrated with major health record systems, and this is really so that we get to take the two major pain points we've heard from clinicians out of being pain points. One is the casework required to personalize dosing, and the other is the fact that you need to do this when you're rounding a patient at the bedside. So our EHR integrations allow us to offer a suggestion and convert it into a personalized medication plan in a minute or less, right at the bedside. So what does this actually look like? Imagine you're a physician or a pharmacist, part of an accountable team, rounding, let's say, a liver transplant patient, and you have to give this patient a drug like tacrolimus to prevent organ rejection. But there's a risk on the other side that you might hurt their kidneys. You would go open up your favorite EHR system, Epic or Cerner, pull up the patient, and there'll be a tab where you would see something like this. All the patient information would automatically get pulled in. There are a few optional settings, but really, as a care provider, you are choosing the care model and setting a therapeutic goal. And in a minute or less, you'll receive a result screen like this, which gives you a recommendation for, in this case, 3 milligrams of extended release pills every 24 hours. And not just that, a personalized forecast that this patient will be in your desired therapy goal state after 4 pills in 4 days' time. So we've built models like these for over 14 drugs in 6 classes. Think about antibiotics, anti-seizure medications, immune suppressants, and so on. And we take this platform and license it to hospitals and health systems. Dominique mentioned we were part of the accelerator program. Going into the accelerator, we had one hospital that was already licensing our software, so we're post-revenue. But in the last few weeks, we've added a second hospital client, 2 pharmacy networks that are servicing 54 additional hospitals through our software. And we've also started recruiting distributorships in other countries. So we have an LOI with for a distributorship in Asia Pacific, representing 6 countries, where in total there are over 40,000 hospitals. We're also really happy about a strategic clinical trial partnership with a major US clinic. I'm not allowed to disclose their name yet. But this really allows us to go from providing recommendations purely in an inpatient setting to an outpatient setting with care orchestration. What this might look like is something like this. And, maybe this is too much detail here, but imagine that liver transplant patient being able to go home a week earlier, and all the coordination you need of labs and maybe even genetic panels in order to optimize dosing happens in the comfort of their home. And you have a service, and we do the back end of coordinating, mobile phlebotomy labs and all that. But we have a service that also includes the patient in their own care so that they can see what the drug is doing to their body. They can punch a button and say they're feeling dizzy if they're feeling dizzy. So that's the scope of the trial that we're really excited about. And this transition from purely inpatient dosing optimization to outpatient dosing optimization expands our serviceable market we put the inpatient market at 2 billion in serviceable revenue to about 22 billion, which is a twofold expansion of our market. Now, how we make money is by selling multi-year licenses to our platform. We also have integration services if there's EHR integrations involved. But really, at the core, our billable unit is when we take a patient and personalize the treatment for them. That means our revenue projections are really tied to how many treatments we personalize. With our first few clients, and one of them has already renewed. We're in 5-figure ARR right now. And for us to go to 100 million recurring revenue, we need to get to 8 million treatments a year. That is less than 5% of the serviceable market. And we think we can get there with the right investments in about 5 to 7 years. We do have incumbents in this space. If you look at the inpatient space, and we compete with the incumbents on the quality of our user experience as well as on price. But really, from a technology investment perspective, we are focused on the outpatient space because it's 10 times bigger, and we have the opportunity to generate IP that will be totally differentiated. We have different strategies in going to market in the US versus outside. In the US, we are focusing all our resources there, and we're going directly to hospitals, going through GPOs, and we are excited to partner with folks like some of the people I've heard from that can integrate our services into a larger, value-based system or some other integrated system. Outside the US, we are not investing any dollars, but we have had organic product-led growth, which is people accessing the non-PHI sensitive parts of our platform. And we're really happy that over 1,000 clinicians in 30 countries and all continents are using our software. So we actually know where future demand globally is going to come from, and we're pretty excited about that pipeline as well. We are a team of 4. My co-founder who's on the call is an expert in data science. He's written open source packages and books on it. Between him and I, we have deep experience in building data platforms, financial services, as well as population health. My background's in biophysics, financial services, running data science and strategy. We also have a team of amazing advisors, clinical, academic, people from big pharma backgrounds, former VCs, and so on. So they really supplement and complement the skills my co-founder and I bring to the table. We are raising our first external round. My co-founder and I have already bootstrapped for about 1.5 years. We've put in about 200K of our own money so far. But we are raising our first external funding for 2 things. One is the outpatient clinical trial that we want to generate IP with. The other is to grow our ARR to about 300K. Now, to support this, we need to increase the number of models we service. And we have a strategy there around hard to titrate drugs, super expensive drugs. Mental health is a major gap in the market. And we need regulatory approvals outside the US, as well as trust certifications to be able to do business globally. I'll pause there. Happy to take questions. Happy to partner. Thank you.